à tout le monde et bienvenue à notre webinaire sur le nouveau programme dentaire du Canada. Je m'appelle Anne Lagacé Dowson, je suis l'animatrice de cette soirée qui se déroulera en anglais, mais on pourrait répondre à des questions posées en français dans le chat, si vous voulez bien. So greetings and welcome to part 3 of our ongoing series, which our wonderful colleague Tracy Glynn cooked up the title of, which is Healthcare with Teeth. So this is part 3 of the series. And I'm speaking to you from the unceded territory of the Haudenosaunee or Kanyankahaka people of the Mohawks of Jojage or Montreal. And we acknowledge the traditional ancestral unceded territories of all of our Indigenous sisters and brothers across this country known as Canada. Just to introduce you, for those who aren't familiar with the Canadian Health Coalition, it's a public advocacy organization, a coalition of civil society groups, researchers, and unions concerned about public health care. So welcome, a warm welcome to everybody who's joining us. And tonight we're super lucky to have the new finance critic, former health critic of the NDP, Don Davies, joining us along with Brandon Doucet. Each of our two speakers will address us for 5 to 10 minutes, and then we'll open it up for questions, which I invite you to put into the chat. And we'll try and get to as many questions as possible. And make sure that we're as fair as we can be about it. So just to mention, Don Davies is the MP for Vancouver Kingsway. He's been the MP since 2008, and he is the first MP to win that riding 4 times consecutively. He was the health critic until last week, and he had been since 2019. He's now going to finance. He's a lawyer, a labor lawyer, and one of the most prolific and productive members of Parliament by any measure, one of the architects of the pharmacare and dental care programs, both first steps toward universal coverage as part of the cooperation and supply agreement between the NDP and the Liberals. Brandon Doucet, and Don joins us from Ottawa, right? Right. And Brandon Doucet joins us from New Brunswick. Where are you, Brandon? Not in New Brunswick?
I'm in Halifax.
Oh, sorry, wrong province. Halifax, Nova Scotia. He is a practicing dentist and founder of the Coalition for Dental Care, author of About Canada Dental Care, published by Fernwood, which I invite you to peruse and pick up, because it's a pretty interesting portrait of what happened and why dental care wasn't included in healthcare at the outset. So let's just start with you, Don. Maybe you can speak to us for 5 or 10 minutes, just cover the latest developments, and then we'll throw it to Brandon, and then we'll take it from there. So over to you, Don.
Sure. Well, thank you. I'm calling in from Ottawa, the unceded territory of the Algonquin people, and I want to thank the Canadian Health Coalition, my wonderful colleague, Dr. Brandon Doucet, and you, Anne, for inviting me to this. The change in critic portfolios just happened last week, so I still kind of feel like the health critic for the NDP, and today was my first day as finance critic. And the reason I point that out is because I'm going to be making a bit of a transition, but I still think it's at a critical juncture to make sure that the dental care plan is launched as successfully as we know it can and should be. And there's still a bit of work to do. And I frankly think at this point that some of the last remaining important issues to make sure that it does launch properly are financial. So I think that my new perch as finance critic for the NDP may prove to be very helpful as we finish off the last few details of this very exciting plan. I'm just going to say a few words about the plan before I tell you what I think the current remaining major issues are in terms of its implementation. But I still think that it's important for us to situate this as the single biggest expansion of public health care in half a century. We were told it couldn't be done. The civil service told us it would take 7 years. People said that you couldn't do a national program. People said that the provinces would torpedo it. And here we are in April 2024, basically less than 60 days away from the first enrollees in the Canadian Dental Care Plan being able to go to the dentist, which is in May. So I think it's really important that we take a moment to celebrate what has been, I think, the dream of many, many people, from stakeholders to oral health professionals, to citizens, to retirees groups, to trade unions, to healthcare stakeholders, who have been pointing out this gaping hole in our public healthcare system for decades and decades. You know, oral healthcare is primary healthcare. It has been treated as a luxury. It's been treated as a cosmetic issue. We have been tolerating a two-tiered approach to dental care in this country for far too long. And we are poised to see some 9 million Canadians be able to go to the dentist for the first time starting in May. You know, where we're at now, as we know, Sun Life was the insurance company that won the contract to enroll patients in this plan. We know that they, from the beginning, told us they could enroll about 500,000 people a month. And with the 9 million estimated people, we decided to start that in December, starting with seniors first. We have been, from my last count, I think we've enrolled over 2 million seniors over the age of 70 at this point. And starting in May, we will do the 65 to 69-year-old cohort. And then starting in June, we will open it up to adults with a disability tax certificate and children under 18. We expect to see the first people actually go to the dentist starting in May. And it'll probably be those seniors who first were enrolled will start receiving their dental care cards and being able to make appointments in May. We expect, of course, that the cohort will, the children under 18 and people with disability tax certificates starting in June will be enrolled throughout the summer and into the fall. And then by the sometime in the fall of this year, it should be opened up to people of all ages who meet the two basic requirements, which are income under $90,000 and people who don't have any kind of private dental insurance. And those people will then continue being enrolled through 2025. The two major issues that remain at this point, I think, have to do with the fees, the dental fees. Actually, I'll say there's three issues. The dental fees. Second, there's been an issue about retirees who have taken post-retirement extended health benefits, who are under the current rules set by the Liberals excluded from enrolling in the plan. And finally, there is, I think, the outstanding issue of extra billing. I'm just going to briefly touch on each one. The position of the NDP from the beginning of this program has been that the oral health professionals should be able to bill 100% of the prevailing market fees. So for dentists, we think that the fees set by the CDCP should be set at 100% of the each province's dental fee guide. Now, I wouldn't tie it to that because we know that dentists set their own fees, dental associations in this country, province by province. These are not negotiated with the government. So the government can't reasonably be expected to tie it automatically. You could have dental associations increase their fees by 10 or 20% next year. But what I do say is that we should set the numerical number at close to 100% this year, and then we can each year carefully evaluate if the fees go up in a way that we think is irresponsible, then we don't have to do it in lockstep. But the CDCP should be setting their fees, I think, at what the market is charging in each province. I say that for a number of reasons. One is, from the beginning, I've said this is not a poor person's plan. Number two, I don't expect oral healthcare professionals to subsidize this plan. Number three, that is the way that you disincentivize any extra billing. Now, you may know that in the Confidence and Supply Agreement, the NDP insisted that there be no co-payments for people who earn under $70,000, and then the plan should pay 60% between $70,000 and $80,000 and 40% between $80,000 and $90,000, with no other co-payments. There's only two ways you can prohibit co-payments. You can legally prohibit it, which we have asked the federal government to do. They claim that constitutionally they can't do it because it's a provincial jurisdiction issue. Then the other way to do it is to remove the economic incentive to balance bill, which is to make sure your fees are fair to the professionals. They won't need to balance bill if they're getting paid. Now, for some reason, the Liberals decided to float a 2023 CDCP fee guide that probably averaged, depending on how you look at it, about 82% of prevailing fee guides across the country. Through the NDP's constant advocacy and the advocacy of many dental associations and stakeholders across the country, I think the government has moved on that. I think the 2024 fee guide that they've set, from my understanding, should be up around the 88 to 90% fee guide. And then it gets quite complicated because the government will say that there's a lot of fees that are set between 90 and 100% of the most commonly used procedures, and others that are not so commonly used or that they don't think has a lot of therapeutic value. They're saying that they're paying less. So put it this way, the NDP is going to continue fighting to make sure that the fees set for this plan are fair to every dental healthcare professional. And again, we're fighting to make sure that there is no copayment. The final issue about retirees. Now, in fairness, this plan was designed from the very beginning to be a plan for people with no dental insurance. That's how we figured out the budgetary amounts, which is $13 billion over 5 years and $4.5 billion in ongoing funding. By the way, I think it's that those figures might be fluid, it might be more than that. But they also estimated that 9 million Canadians would qualify. Like all programs and policies, when you implement it, you discover issues that arise. And one of them that nobody anticipated was this issue of seniors who, when they retire, you have the option of continuing your extended health benefits, but you usually have to pay for it. And usually the plans are a fraction of what you had when you're working. So I've heard stories of people paying $100 a month for a plan that gives a maximum of $750 of dental work a year, or $1,000 of dental work a year. So these seniors that have elected for these plans, and if they opt out of them post-retirement, they can't opt back in, feel aggrieved because they're seeing this plan being offered to seniors who didn't have any kind of plan, and the CDCP is a much better plan. It's got a broad basket of services, and it doesn't have limits. These seniors have said that they think it's unfair. So what I've brought to the Minister of Health is I've said we should give seniors in that position a one-time option to withdraw from their current extended health plan if they want to and join the CDCP. That's been the position of the NDP. I'm not sure that we're going to be successful in that, but it is something that we can deal with in the future as well. So where I'll conclude is by saying that we're hearing a lot of excitement across the country. I'm hearing that dentists are signing up for this program, and dentists are being cautious across the country because of the fee issue. I know a lot of people are raring to go to the dentist in May, and we're going to keep a close eye on this plan to enroll as it rolls out, because I think it's crucially important that this plan be successful. It's very important that as the very first expansion of dental care in this country, that we avoid the mistakes of the past. We make sure that it's a good program with a good array of services that is well paid for, and people can get the oral health care that they need so that we can have a sustainable plan for the future. And that's what's motivating us at this point of the game. So I look forward to hearing the views of Brandon and others on the panel, and listening to your questions and guidance from those that have joined the chat. Welcome, by the way, to everybody who's taken time to join us tonight.
Thank you very much, Don Davies. And I'm just going to I'm going to jump into some of the Q&A before I throw to Brandon, because some of the comments are directed directly to Dr. Doucet, including one from an anonymous attendee who says, "Where can patients see you? My parents would like to see you as a provider, but we called your office and they said you no longer work there." So it's pretty personal for you, Brandon. And I wondered if you could pick up on the question that Don alluded to or mentioned, the question of how many dentists are participating, because here's a comment from somebody who says they lost their dental benefits upon retirement, just as Don mentioned. And I'm wondering, what's your sense from your colleagues, your cohort of dentists? So let's start with those two things. Please jump in and say and address whatever you want, but already we have lots of participation in the Q&A. So over to you, Dr. Brandon Doucet in Halifax, Nova Scotia.
Thanks, Anne. So just to start off with answering the question of being able to be one of my patients, it might be a little bit difficult now because the last 2 years or so I've been working mainly in a federal prison. So, it might be best if you weren't one of my patients. But that being said, I still do a tiny bit of work in private practice, but it's very minimal in comparison to before. And yeah, I would like to add a little bit of context for the Canadian Dental Care Plan, and then follow by adding to some of the things that Don has already mentioned. So just to start off with, in Canada, 1 in 3 lack any form of dental insurance, and over 1 in 5 avoid the dentist each year because of financial constraints. And these are numbers that have actually been increasing. Canada's public dental spending, it's not always been so low. In 1980, public dental spending accounted for around 20% of total dental spending, but in the decades that followed, this has withered away to its current rate of 6%. So since so many Canadians lack access to dental care, poor oral health is forced onto a lot of people, and it has a lot of consequences on their overall health, the broader society. And I'm very thankful that Don Davies and the federal NDP has seen this problem and placed it as a high priority when negotiating with the Liberals, because in exchange for the NDP support, the Liberals in this minority parliament, the NDP demanded that their dental plan be implemented, and this dental plan became known as the Canadian Dental Care Plan, as we've been talking about here. And it seeks to provide dental insurance to people without private dental coverage and have a family income of less than $90,000 per year. And it's expected to help up to 9 million people, as Don mentioned. And it is the largest investment in public dental care in Canadian history. So I want to keep that in context when we go into some of the problems that we're facing here. This is still definitely a big step in the right direction. So while this is great news, we definitely have challenges ahead. To understand the biggest disappointment so far, as Don was briefly alluded to, we need to understand how billing works in dentistry. So each procedure a dental provider performs, so say a simple extraction or a 2-surface filling, has a code associated with it. And the provincial and territorial dental associations make a fee guide each year stating what each procedure should cost. These fees are just a suggestion, so dentists can bill above the fee guide, but many follow it because this is what private insurance plans follow. And in order to prevent discrimination against people on public dental plans, the fees the Canadian Dental Care Plan pay out need to be the same as the provincial fee guides. Otherwise, dentists can make more money treating people with private insurance. Despite this, the Liberals originally set the fees for the Canadian Dental Care Plan at around 80%, as Don mentioned, of what the provincial fee guides recommend. But with pressure from the NDP, this has been brought up to about 88.7%, which is a number that the Nova Scotia Dental Association told us last week. Seeing this discrepancy in fees, though, organized dentistry, who work on behalf of dentists, have been lobbying aggressively to be able to charge patients the difference between the Canadian Dental Care Plan fees and the dentist's normal fees. This is a practice known as balance billing. So allowing balance billing in the Canadian Dental Care Plan means the Liberals are breaking their promise to implement a dental plan with no co-payments for those with a family income of less than $70,000 per year, because balance billing means those people will face around a 15% co-payment to make up the difference from the lower fees in the Canadian Dental Care Plan fee guide. On top of this, those who expected to have a 40 to 60% co-payment because their family income was between $70,000 and $90,000 per year will see an additional co-pay with balance billing. And while the Canadian Dental Care Plan, the coverage, and it's not perfect, it is far more comprehensive than any other provincial public dental plan. So it is quite good in that sense. Not perfect, but it is, if you go through the details, fairly good. And it's way better than provincial programs like Ontario Works and the Ontario Disability Support Program. They're not even close. The problem arises for me with the higher than expected co-payments. It will lead to many people only using their newfound coverage for emergencies rather than comprehensive care, because they won't be able to make the co-payment. So, people will opt for the cheaper extraction rather than a root canal and a crown. The next problem we have is getting dentists to take up patients in the Canadian Dental Care Plan. In theory, dentists should be happy with this program, as it does not disturb the private practice fee-for-service model that they love so dearly. And with balance billing, dentists can charge their normal fees. So the Canadian Dental Care Plan really gives them access to millions of new customers who can now pay the fees. One thing dentists have not received with the Canadian Dental Care Plan, though, is the ability to just charge patients their full fees out of pocket at the time of the appointment and give patients the paperwork to get reimbursed for their portion on the back end. Which, if you're going to do this, why even have a dental plan in the first place? Because people won't be able to use their plan. But it is something that the dentists have been pushing for and they haven't gotten. But over the last few decades, though, organized dentistry has released many policy papers saying what they would want from a public dental plan. And without completely disregarding patient protections, the government, it's basically given dentists largely what they say they've wanted. So my question now is, why are we seeing last week in the CBC, we were seeing presidents of many of the provincial dental associations saying that they're not signing up for the Canadian Dental Care Plan in their own clinics, and say things like, think before you click to dentists, trying to evoke fear out of the idea of signing up for the Canadian Dental Care Plan. I've also seen them say things like, it's a one-size-fits-all solution that could jeopardize access to care to millions of people. And, these outlandish claims that really are trying to evoke fear from dentists from this plan, I think it's very irresponsible. And we can't overlook the fact that, historically speaking, most dentists haven't wanted public dental care. And, we really shouldn't expect anything different here. In the 1980s in Saskatchewan, organized dentistry successfully dismantled the most successful children's dental program in North American history. And studies have shown that children's oral health in the province has suffered as a result. And with the way organized dentistry has acted towards the rollout of the Canadian Dental Care Plan, I do worry that this history is just repeating itself. The dental associations have been saying that this plan is being rushed and we need to delay the implementation so we can get it right. But the reality is that they're just trying to delay the plan until after the next election, which they know, like all of us do, that it will likely be a Conservative majority and therefore the program will never come to fruition. And I say this next part with the utmost sincerity, but in my opinion, the dental associations have been acting with reckless disregard to the health and well-being of low and middle income Canadians. I'm tired of seeing people who have tried to extract their own teeth because they were unable to afford care. See, but because dentists have a monopoly on care, the government does need to get them on board. And to do this, they need to set the fees for the program at the provincial fee guide levels. As Don mentioned, this will greatly reduce the out-of-pocket expenses for patients, but we also need to deal with other issues in the long term to make sure that the provincial dental associations don't then just raise their fees far higher than inflation, knowing that the government has tied the Canadian Dental Care Plan fees to this. Over the last 20 years or so, we've actually seen in Ontario the dental fees in their fee guide rise at twice the rate of inflation. So this has been an ongoing problem in here and something we need to actually address. Unfortunately, that's done at a provincial level, so it's more of a long-term project. But the next thing the federal government can do to help get dentists on board is to allow patients to show up to dental clinics and use their Canadian Dental Care Plan coverage without requiring dentists to show up. I do think that this would get a lot more patients care. But the hard thing will be that in doing this, they also need to still have protections in place that do not allow dentists to charge patients the full fees up front so that the patients can get reimbursed on the back end. And that's going to be the difficult thing if they don't have to sign up ahead of time, which that's one of the things in the sign up thing. It says you can't do that. But I do see the Canadian Dental Care Plan. It will function largely like a private insurance plan, and dental clinics already take private insurance. So once it becomes normalized, I do think dentists will start seeing this for the win-win that it is, but we do have some hurdles to overcome to make sure that next month when people actually have those benefits, that they're actually going to be able to use it. And that's something that I really worry about, because if people aren't able to use their benefits, and the plan isn't largely viewed as a success before the next election, it's going to be a lot easier for a Conservative government to take this program away. So I believe we can meet these challenges. I think there's very tangible things we can do to help make this plan a success and make sure that it gets off the ground in a successful way. And, really what we need to do is make the Canadian dental care plan a success, build off of that momentum so that we can start fully integrating dental care into our healthcare system.
Thank you very much, Dr. Doucet. There's quite a few questions lined up in the Q&A. I'm going to just do a little triage with some of the questions. Some of them are repetitive, so I'm going to give you 3 questions. Unless you want to just quickly jump in, Don, and comment on what Brandon said, or I think it might be more time efficient if we just go straight to the questions, because there's a lot of them.
Sure, just go straight to the questions, Anne.
Okay. So there's several people who've expressed concern about the participation of dentists, including someone who said that the word on amongst dentists is just stay out of it, stay away from it. There's a lot of skepticism, and they're being told by their professional bodies to stay back. And then there's indications from some of the questions. Public health dental clinics will have difficulty enrolling. Sun Life requires each dentist treating patients to register. So there's like procedural or bureaucratic blockages. And then other dentists are just flatly saying they're not going to join. So I wonder if we can address that, the sort of issue with regard to dentists and sort of cumbersome and bureaucratic issues around their enrollment. Somebody who sent in a cute comment saying, I'm old enough to remember when dentists visited schools in Ontario. I'm one of those people who remembers that too. That's probably why I have some of my teeth now, actually.
Yeah, I'm happy to tackle some of those, Anne, and I'm old enough to remember dental hygienists coming into schools where they would clean your teeth, and I remember they'd leave this colored pill you'd have to have that would show how well you brushed your teeth. So,
is there any, sorry, just to jump in, Don, is there any chance that might actually ever happen again? Because that seems to me to be one of the best ways to tackle the issue overall, is to get into the schools and get the kids cleaned up and organized.
Well, the answer is yes. I mean, a lot of that is provincial programs, but
right.
It does give me a chance to comment that one thing the NDP insisted on was these $250 million oral health access fund. So that's money that's going to be over 3 years and then ongoing. I think it's $60 million a year, if I'm not mistaken, which is intended for oral health professionals across the country to apply to come up with innovative and creative ways to extend oral health care access in the country. So it could be things like mobile oral health clinics, hygienists and dentists going into care old folks' homes. I even heard one proposal to refit a train car and have it go up the track to hit small places so that we can get oral health care into remote areas. So I think we can do a lot of experimenting that way because there's a lot of work to be done. This is a dental care plan, and it's ambitious, but let's put the corners around it. What we want to do is make sure that a normal dental care plan is available to everybody who doesn't have one now. It's the first stage. But we do need a renaissance, I think, in oral health care. Things like fluoridation programs, setting up community dental, multi-team community dental clinics, greater use of dental therapists, more focus on prevention. I mean, there's a lot of things we can do, and Dr. Doucet will be able to elaborate much more than I can to improve oral health care in this country beyond just the dental plan. But to address this plan, I want to, I'll get really sharp to the point here on this. While in theory, I've been saying it should be 100% of fee guide, I think where this plan is going to end up is probably around the 90% of fee guide. I think that's going to be enough to make it successful. And I'll tell you why. There are other aspects to a plan besides just the fee. We heard from the beginning, back 2.5 years ago when I first started working on this, that dentists want a plan that is easy to administer, where if they need to get predetermination for a procedure, they can get that predetermination in a fast manner. They want to make sure they're reimbursed quickly. That message was pounded into the government by me and others for 2 years. Now I'm told that the administration of the plan that Sun Life has designed is going to be very administratively effective and efficient. I've heard they have a reimbursement service standard of 48 hours, meaning that the dentist is going to get paid within 2 days. And in terms of signing up for a plan, that's no different than any private plan in the country. Whether you have employer-provided plan through Manulife or Green Shield or Blue Cross, the dentist's office has to sign up and do the administration. And finally, the federal government is paying Sun Life directly, so there's going to be no bad debts. The dentists aren't going to be chasing anybody for money. So when you put all of those things together, it's a fairly attractive proposal, I think, for dental offices. I'm still stuck on the 100% because I still think in principle that's what it should be. But from a pragmatic point of view, if we can get the fees at 90% with the other efficiencies, I don't think there's not any really principled reason that dentists should be troubled or reluctant to participate in this plan, I think. And the final point I want to make is I've had the luxury and privilege of talking to a lot of oral health professionals in this country, from dentists to hygienists to denturists to dental therapists to dental assistants. And these are health professionals. They're running businesses to some degree, and this is their income for sure, and that's as it should be. But they're also dedicated health professionals that care about their patients, and they want to see their patients get the care they need. So most public healthcare plans in this country pay a fraction of what we're talking about here. They pay 60% and 40% and 50%. This is an excellent program that will allow people that desperately need care to go to their oral health professionals. And I think a lot of oral health professionals are going to be very enthusiastic about wanting to jump in and making sure Canadians and their patients get the care they need. Yeah, I'll stop there.
Yeah, I'm going to jump in and I'm going to bundle some questions together and then throw it to you, Brandon. So somebody who wrote in to say how to help people who don't file income tax returns, people who are unhoused, people who suffer from extreme poverty, people who don't file income tax return and yet need dental care. That's one question. Somebody who asked about the possibility of dentists being audited by the government, which fills them with dread and puts them off participating potentially. Maybe you can address this, Don. What, if anything, have the Conservatives said about their intentions with regard to the dental plan? Like, would they actually dare dismantle it once it's in place, I guess? And then a couple of people have inquired about implants and other sort of what could be perceived as luxury treatments for those older patients who've actually lost teeth. Is that something that could eventually be covered? And finally, is there going to be a registry of an enrolled dentist so people know who to call to try and get an appointment under the program? So I'll let you tackle some of those issues, Brandon, and maybe you can jump in, Don, on the question of the Conservatives. I think that's on a lot of people's minds right now. Go ahead, Brandon.
For sure. So the implants will not be covered by the Canadian Dental Care Plan, but a vast array of basically routine dental procedures are, even including things like root canals of front and back teeth, crowns, full partial dentures, fillings, cleanings. You know, there is a broad array of services of routine dental care covered. As far as trying to get coverage for people who don't have tax filing, correct me if I'm wrong here, Don, but one of the components of the Liberal NDP Supply and Confidence Agreement was increased funding for automatic tax filing. And I believe that there was basically, you know, it hasn't been kind of keeping up with some of the promises, from my understanding. So from my understanding, it's basically we need to make more improvements on automatic tax filing for people so that they can get more help with that, so that they can get access to this plan. I think ultimately, if we can move in the direction of it being a right of citizenship, then that would be much better. But if the program's means tested, they have to be able to figure out, you know, what your income is, unfortunately. And that's going to make some of the people who need help to access the plan most have, you know, the hardest time getting it. Unfortunately, I wonder, Anne, if you could remind me of some of the other questions here. I was only able to remember two.
Government audits of dentists.
Okay.
That was a
Yes.
concern that was raised. And just generally the feeling that it's going to generate a lot of work for office managers, and it's just too much. It's just annoying, and people they're not going to want to join the program.
For sure. And I mean, that would be also a lot of work for the government as well. I don't think they're necessarily wanting to do that all the time for dentists unless there's something really out of the ordinary. If a dentist billed 20 fillings or something like that, it might be something that we have for a single patient. We might have to scratch below the surface a little bit and look into that, or if that was like a routine occurrence. But that's actually something that I remember when I first graduated dental school, I had to actually sign up for the various private health insurance things. And I'm sure that was a component of signing up for those programs to be able to build them, is that, if there's something that's very out of the ordinary, they can go into our records and, check those things as well. But the government definitely doesn't want to be doing that all the time, because it's just going to waste time and resources on their end as well. And as far as,
but what about the concern, because it's come up several times, like dentists are like, yeah, we got enough problems. We don't want to deal with the extra, work that this seems to require.
So from an auditing perspective, I don't think they're going to have excess work. I just don't think that's going to be the case. As far as the predetermined, as the process of using the plan is going to look very similar to a private insurance plan, which dentists and dental clinics already do all the time. As Don has said, there's a 48-hour turnover period from when dentists are going to be billing to when they're going to be getting paid. There's going to be a mechanism in place where dentists are able to tell their patients, how much the plan's going to be paying out for them, so that they're able to give their patients a warning ahead of time of how much their co-payment is going to be. It's very much going to work like a private insurance plan, which is a pretty seamless thing for private dental clinics because they do that all the time already. I think this is going to look very different than many of the existing public dental plans because they're so meager, like the provincial dental plans. A lot of the times they don't work. There's a lot of paperwork, headache, and burden associated with them. So there is a distrust from the dental profession because of how badly some of those public dental plans work. But from a funding perspective, this program is increasing public dental spending in Canada from about $1 billion per year to about $5 billion per year. So, we have the money here to try to make a plan like this work. So I do think that this is going to look very different than many of the existing public dental programs. So if people have, hesitation towards this plan, I do recommend trying to have an open mind in this, because I do think that it very well will be a win-win for both dentists and patients.
So how do patients find a dentist that's part of the program? Will there be a registry? Like, how will you actually find somebody who can?
Unfortunately not. And that's something that I've been pushing the health minister's office and Health Canada, and they've received large pushback from the dental associations basically saying they don't want that. The dental associations don't want to have a list of dentists who are signed up for the program. So that's why we don't have one, unfortunately. And that's going to make it a lot harder for patients. And there's going to be people who have to, pay for care out of pocket as a result, unfortunately.
So Don, what's your sense of what the Conservatives might have up their sleeve? Here we are trying to expand healthcare while the healthcare system is under enormous stress and increasingly profitized and privatized. There's no reason to think the Conservatives are, proponents of public healthcare. So what's your reading of the Conservatives' intentions?
I'm very worried. The Conservative, I've had a front row seat to watching the Conservatives and listening to their policy for 16 years in the House of Commons, and they don't like public health care. They like private health care. And this is, as I said, the biggest expansion of public health care in 50 years. I can tell you factually that they have refused to say that they will keep the plan when asked directly by reporters as recently as last week. And I can tell you that they voted no in the House of Commons to our motions on dental care. So to me, actions speak louder than words. Talk is cheap in politics, but their behavior and their refusal to endorse the plan tell me that they would love to get rid of this plan at first opportunity. That's, by the way, why I think it's really important that this government stay in effect for at least until 2025, so that this dental plan is fully established. Because I think, how many seniors in this country make under $70,000 a year and don't have dental insurance? Lots of them. How many single moms with kids can't go to the dentist. Well, 32%, Brandon said, don't have dental insurance in this country. I think it's a lot harder to take away dental care from 9 million Canadians once it's established. So, you know, people talk about why we're supporting Liberal government. We're not, the NDP is not supporting Liberal government. We're supporting those 9 million Canadians who we know have suffered deeply. And we want to make sure this plan is as hard as possible to take away. I want to just address a couple of the other things quickly. Look, the NDP believes in universal health care as a matter of right, as Brandon said. We view this as a down payment on universal dental care. I think everybody should be able to go to the dentist just like you go to the doctor in this country. I don't think there's anything unique or special about dentists, any different than a heart surgeon or a kidney specialist or someone who, you know, any other physician that we have. It's only an anomaly of history that we don't have it. As I've said many times, dental care was supposed to be part of our public healthcare system from the 1960s. So ultimately, we don't want a means tested system, but as long as it is means tested, people will just have to file their tax returns. That's just the unpleasant reality. And you know, I think that we need to expand resources to people who have difficulty doing that. But the income requirement is coordinated through the Canada Revenue Agency, and so there's just no way around that. They're just going to have to do that. And until we can make the next step to making it universal through a public healthcare system, this is what we're going to have to do. On the audits, quite honestly, I'm going to say this. I think there's a lot of fear mongering. I think there are people who are ideologically opposed to public dental care, including in the dental profession, by the way. And there's people who are just legitimately concerned and have reasonable fears, as Brandon said, because anytime this has been tried by provinces in the past, frankly, it's been right-wing governments that have generally destroyed these programs by underfunding them. Dentists are quite honestly or quite reasonably nervous about it, but there's not going to be any big auditing. I mean, every plan of all types reserves the option of, if they see funny billing going on through an office, reserves the right to go in and audit. And I think taxpayers would want that. We're spending billions of dollars a year on this. I think it's responsible for us to make sure that the money's being spent properly. But there's not going to be any extraordinary auditing of dentists any different than any other plan does in this country. So to me, that's just a scare tactic and a canard that's not going to happen. I don't think at all.
Okay, so several people have asked about access to hygienists. If in fact the program takes effect, is it possible simply to just see a hygienist and not necessarily a dentist? Just get an assessment and get
absolutely.
a cleaning. Okay.
Absolutely, yeah.
Right.
So there are independent dental hygienists in many provinces who are allowed to work, you know, outside of a private clinic with a dentist in it. It is up to them whether or not they're going to be signing up for the Canadian Dental Care Plan. For dental hygienists who work in the traditional private practice model, where there is kind of the dentist as kind of the owner of the clinic, I do think that they'll largely be the ones deciding whether or not providers in that clinic are signing up and taking those patients, because they not only are they the dentist, they're the boss in that situation too. So I mean, there will be dental hygienists who might want to participate in the plan, but their clinic is being told they're not seeing patients in the plan. So.
Okay, so Kim Lawrence wrote us to say on Sun Life, there's a listing right now. Dentists have a registry with a picture and information. RDH are listed by name. Look at the Lumino website. Apparently that's a list of providers. I don't know if you are aware of that. Does that sound right? Lumino?
I haven't heard of this.
Okay.
Like there's a list of dental providers, as in like my profile is on that because I'm a dental provider in a certain community. I don't know if it specifically says if you're taking the Canadian Dental Care Plan on that. To my knowledge, I'm not aware of that. And the last I heard of it, that was not information that they were publishing, to my knowledge.
A couple of questions for you, Brandon, that concern whether or not you've ever worked in private practice and why you choose to practice in a prison context, which I personally think is laudable, but is a bit puzzling to some of the people on the webinar. Can you elaborate a bit on that?
For sure. So I started working in a federal prison over 2 years ago before any talks of the NDP dental plan was coming to fruition. And it was something that I like doing surgery work. So basically seeing cases where people need most, if not all of their teeth extracted. Since graduating, I worked in rural Newfoundland for a few years in private practice where I was able to gain a lot of experience in this realm. It's unfortunate that people get to such a late stage of dental disease. Um, but the unfortunate reality is with the current dental care system, a lot of people do end up at that stage. And I do find it rewarding to be able to help people get them out of pain, help them deal with infection. And yeah, basically try to get people back on their feet because when they're in pain, it's really hard to live a good quality of life. So I do feel like being able to get, dozens of people out of pain each week is a very rewarding thing. I hope we can move to a world where more people are saving their teeth rather than having their teeth extracted. But yeah, moving to the federal prison system has just basically been a way of me getting to do the surgery work that I like to do more and being able to do more of that.
Some of us are related to people who've had all of their teeth extracted because of poverty and privation and ended up with full mouths of dentures, like my dad and many people from his age cohort. I mean, that was just a common practice. And in Quebec, it was rampant, the extraction of teeth. And I wanted to just touch on what is going to happen to provinces like Quebec, where the premiers are saying, no, 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 we're not doing that. And yet there's great interest and a lot of support for dental care in Quebec. I wonder if you could jump in on that, Don.
Sure. Well, this is quite an innovative program in the sense that this is 100% federally administered, 100% federally paid. So outside of a theoretical objection on constitutional grounds, I can't understand why a single premier, even from Quebec, would have any objection to the federal government paying to have the citizens of that province have their oral health care needs met. And frankly, I know that there's been huge public support and public enrollment from Quebec. So the Québécois and Québécoises, they want to have access to dental care. So if we were asking the provinces to pay some money or to contribute, then I think it's a different story. Then I think you have to work with the provinces. But I'll give an example: employment insurance. Okay, you lose your job. You file your application with the federal government. The federal government processes it and sends you your checks. That's a form of insurance. This is the same kind of concept. You go to the dentist, you send your administration in, you get your insurance paid. So I think I really don't understand why any premier would have an objection to that type of program. The other thing I was going to mention is we've done something very innovative and creative and different here. I've been in parliaments where I can't tell you what significant things were done. And in this parliament, in 2.5 years, we have managed to create a wonderful program that will allow people to go to the dentist. Now, it's going to be a work in progress. And I think there's going to be bumps, there's going to be issues, there's going to be problems, and we're going to have to refine it, just like we did with our healthcare system. I mean, I don't know what our healthcare system was like in 1969 or 1974, but it wasn't as broad and comprehensive as it is today. And so we're going to have to be monitoring this program really carefully. I really have been a strong proponent of gathering solid data so that we can make the adjustments that satisfy the oral healthcare professionals and improve service. The final thing I'm going to say is just think of this. As Brandon said, by definition, this cohort of people largely probably hasn't been to a dentist in years. You're talking about people that make $20,000 a year, $30,000, $40,000, no dental insurance, living in pain. Imagine these people going to the dentist. They're going to be in a chair getting x-rays for the first time, having dental hygienists clean their teeth, having a full exam. And these fees for these are normative, and they're going to be getting prevention fluoride treatments. Then, of course, as their teeth get repaired, they're going to be able to get access to fillings and crowns and get their teeth, their restorative work that they need. There's even orthodontics in this plan. If it's medically necessary, there's going to be orthodontics covered in this. This is very exciting. And I say these things because I don't want to focus only on the negative and where people are worried about how the plan is going to be perfect. It's not going to be perfect, but it's going to be a hell of a lot better for a lot more people right off the bat. And I hope that we can work together, everybody involved, all the stakeholders, to make this plan work better and to improve it, just like we did with our healthcare system. I think we should do the same thing with dental care.
Okay, and I think it's a really important point to mention that healthcare was introduced in Saskatchewan. The doctors immediately went out on strike. The government of Tommy Douglas brought physicians in from Britain, from the NHS. It was a bitter fight, and then it spread to New Brunswick, Louis Robichaud, and then one province after another. It was a very gradual, possibly irritating progress over time, but it ended up spreading across the country. I wanted to mention, as a parent, the ortho thing is great, because if your kid has a problem with their bite or their jaw or something, that can be like $6,000, $7,000, $8,000 to get ortho. So that's really good news. And Shauna Sutton texted in or wrote in to say that there is a list of dentists participating in the CDCP on the Sun Life webpage. So a list of providers. So people can maybe go check that out on the Sun Life webpage. And a question about Indigenous patients. What's going to happen with regard to First Nations and their access to the program? So maybe you could jump in, Brandon, and then Don.
For sure. So from my understanding, the Canadian Dental Care Plan is structured after the NIHB program for recognized Indigenous people. So they should receive the similar benefits through the NIHB program. I don't believe they would also be eligible for the Canadian Dental Care Plan. Correct me if I'm wrong here, Don. But yeah, basically there's similar coverage for the two plans.
Yeah, no, that's right. Remember, go back to first principles. This is a plan for people who do not have dental insurance. Indigenous people, I think it's about almost 1 million Indigenous people in Canada are covered under the non-insured health benefits plan, NIHB. And we basically use the same basket of services, but because we created this plan from scratch, we have made administrative efficiencies. I've seen in the chat that some people are concerned that the NIHB has the predetermination process takes too long and the payment takes too long. Those administrative issues, I think, have been addressed successfully in the Canadian Dental Care Plan. So now the other thing I will say is that if people are covered by provincial social service plans, so let's say someone is covered, is on social assistance in a province and they're getting some form of dental coverage there, they still qualify for the CDCP. And the payment of benefits will be coordinated. So the federal government will be the payer of first instance and pay, and if there's anything left over to pay, the province will pick up the balance. So those people will be covered quite well. Even though they do have some dental insurance, because it's publicly provided through social services, they still qualify.
Okay, so I'm going to jump in now. A couple of questions from the Q&A. Is there a plan to possibly increase the number of dentists who graduate from schools of dentistry? If in fact the program does take root, there's going to be a need for more dentists. And a question from somebody saying, really, the vast majority of people, according to this person who's participating in the webinar, are more concerned about access to primary care. So many people cannot see a doctor that seems more pressing to this participant in the webinar than access to dental care. If one had to choose, a lot of people would say, I would rather have a doctor than go to the dentist. And finally, what kind of coverage do members of parliament get with regard to dental coverage? Just curious, like if you're talking about Pierre Poilievre, I presume it's pretty gold plated, but I wonder if we could elaborate on those three.
Sure, well, I'll take the last one first. So before I was elected to Parliament, I worked for 16 years for a trade union, and I had benefits provided from work, and I can tell you they were a lot better than I get as a member of parliament.
Oh, interesting.
Oh yeah, we don't have gold-plated plan. We've got a normative plan. I think it's through Great West Life, and it's a pretty middle-of-the-road dental plan. But I will say this, I think the point is well taken, that Pierre Poilievre, as an example, he was elected to parliament when he was 25 years old. And he has been getting taxpayer-funded dental care for he and his family ever since. So, I mean, for him to object to us providing the same dental care that he gets to other Canadians, I think is hypocrisy at the highest level. Your other questions I wanted to mention, what was the other two, Anne, quickly?
The possibility that there might be a need for more dentists.
Oh,
straight up
right.
more dentists, and the other more pressing question, which goes to the larger
Primary
context of
care,
the healthcare crisis. Some people would say, if they had to choose, I'd much rather have a primary care physician than access to dental care. If I have to choose, I want the money to go to primary care. So
I'll handle that, and then I'll leave the question of number of dentists to Brandon. I've had that question from the beginning. So the first thing I'll say is, as I said from the beginning, oral healthcare is primary healthcare. Okay, I reject I think it's an artificial distinction to say, oh, well, we don't need dental care, we need primary healthcare. Dental care is primary healthcare. Second of all, we don't have to choose, and we shouldn't have to choose. If I said to people, would you rather have access to heart surgery or a kidney transplant? Hip replacement or cataract surgery? You can't have them both. We don't make people make that decision in our healthcare system at all. Why would we ask people to choose? Look, we're a G7 country. We're a petro state. I think it's frankly a national shame that we have, we claim to have universal health care, but we carve out this piece of our body, cover tonsils back, and you're on your own, Jack, for the front of your mouth. We've said this a million times, but when you have oral health problems, it leads to cardiac disease. It leads to diabetes complications, infections in your upper jaw go to your brain, lower goes to your chest. Never mind the pain and the class issues. So I refuse to say Canadians have to choose between having a healthy mouth and a healthy heart or a healthy kidney or a healthy brain. It's time that we close this gap in our healthcare system. And frankly, this is the last point I'll say. In 2022, we spent $360 billion in this country on healthcare from all sources. $360 billion. We're talking about adding $4.5 billion to bring healthcare, dental care to 9 million Canadians. That's a third of 1%. So darn rights we can afford that. I just saw that we just allocated $80 billion over 20 years to the military. $80 billion over 20 years. And you know what? Not a single person is going to benefit from a healthcare point of view from that. So this is an investment. And the final point I will say is that this is an investment, not an expenditure. Every dollar you invest in oral health care, some portion of that will be returned to the taxpayer in avoided trips to emergency rooms, in avoided serious health problems down the road. So we should do it for moral and ethical and citizenship issues, but I think there's also a strong economic case to make for it as well. I'm going to slip one last point in. For the dentists out there, we're gonna add $4 to $5 billion of spending into dental care in this country. That's got to be good news for oral health professionals in this country.
As more work and possibly more graduates. Go ahead, Brandon, jump right in.
Thanks, Don. Those are a lot of great points. And to answer the question about needing more dentists, so the Canadian Dental Care Plan is not looking at training more dentists. I think a lot of that would end up being in provincial jurisdiction as well. That being said, though, I do want to note that we do have way more dentists than we used to. Back in the 1960s, the Hall Commission came out and actually suggested that dental care be included in our universal health care, but said it should be done at a later date because we don't have enough dentists. Since then, we've largely alleviated that shortage. That being said, though, I think there's a maldistribution of dentists where a lot of dentists want to live in urban areas focusing on luxury and cosmetic services, leaving a relative shortage in poor and rural communities. So one thing I would like to see, let's say, for example, Don, you just mentioned the added military spending. And, whenever we want to do something in the military, we always seem to have the money for it. But one of the things the military does, it will actually pay the tuition of dentists who are going to join the military afterwards. And, I don't see why we couldn't do a similar thing if a dental student, a prospective dentist, agreed to go work in some sort of remote rural community, or say treating people with disabilities, or various other situations like that, to make sure that people not only have dental insurance but actually have access to care.
Okay, so somebody has written in to say that some people need to go in more than once or twice a year. Some people would benefit from fluoride varnish 3 to 4 times a year. People who have problems with enamel or constant, I don't know. Anyway, so the idea that maybe the service needs to be widened for certain cases. And somebody who texted in to say, how much do we give to oil and gas in terms of subsidies? Why would we balk at financing dentists and dental care? And what about refugees and migrant workers? And what about dental care for people who are in those kind of vulnerable categories who have difficulty getting health care? I wonder if we could tackle that. You want to jump back in, Brandon, and then you, Don?
So correct me if I'm wrong here, Don, but I believe the eligibility criteria is for a Canadian resident and has a tax filing.
Right.
So if people meet that criteria, it might vary on a case-to-case basis for those individuals, but I imagine there will be gaps created for people who are, undocumented, or, going through other situations.
Yeah, that's right. You have to have Canadian residency for tax purposes, and you must have filed a Canadian tax return. So in terms of immigrant or temporary workers, they may or may not meet those criteria. There's no special consideration for those categories. It's just if they meet the criteria, they qualify. In terms of frequency of visits, this plan is designed to be based on medical need. So if you need the work, you should be able to get it. There are no annual limits in terms of money, but there are built-in limits. So for instance, I believe, I'm right on this, you get automatically up to 6 units of scaling, that's cleaning, per year. But if you need more, then you could apply to the plan for predetermination, and the plan can give you more. And I expect something like that to be done quite a bit. If you think of these people coming to the plan who may not have been to the dentist in many years. Like these are not, I've been to the dentist, like I get my teeth cleaned, once or a year, whatever is supposed to get done, and have had for years because I'm lucky enough to have had dental insurance through work. But if I haven't been to the dentist for 15 years, it may well be that I need 8 or 10 cleanings, or as you say, Anne, there might be extra fluoride varnishes that need to be applied. This plan will allow that, but like I said, you get your annual limit, and then you can get more if you need it, based on medical necessity.
Okay, so I'm gonna ask. I guess we're winding up now, sort of heading toward the end of our session for tonight. But there are several irritated comments from people saying, "Well, what about dentists? Should they have to top up?" Like it's come up several times that the dentists are irked and they are feeling like they're going to have to pay out of pocket. I wonder if we could just allay that concern in closing, because I mean, I don't want to overplay it, because the purpose of this webinar is to address concerns of citizens and users of the healthcare system. But if the providers are not happy, or if indeed their complaints are valid, then that's something that I think is on people's minds.
So I would like to start off by saying dentists can charge their regular fees. Whatever the discrepancy in fees are between the Canadian dental care plan fees and their normal fees, dentists are allowed to balance bill the difference. The Nova Scotia Dental Association said last week that they are paying about 88.7% of the Nova Scotia fee guide. So that's what the Canadian dental care plan fees are at. So it's a pretty good rate if you're comparing it to the provincial plans that often pay half of what the provincial fee guides suggest. I still think we need to be fighting to get that to 100%. As far as the administrative burden, if you go through the website, it does say for the vast majority of dental procedures, there's no need for predetermination. It's going to function very much like a private insurance plan. I understand there's skepticism from dental providers, especially considering how dysfunctional many of the provincial dental plans are. But this is a massive investment in dental care. We have the money to make this plan a success. I think that I suggest dental providers go into this with an open mind. There are a lot of misinformation going around, and I hate to say it, a lot of it is being spread by the dental associations, which I think is very irresponsible. But, you know, this plan is giving dentists what they've been saying that they want from a public dental plan. So I really recommend for providers to go into this with an open mind. There is a win-win opportunity for both patients and dental providers here.
Okay. And Don, in closing, somebody made a comment that caught my attention that the NDP and possibly even the Liberals may not get the credit they deserve for this program as the you know, potential federal campaign heats up. I wonder what you could say overall about the political landscape, the backdrop against which this is happening.
Well, the NDP has been fighting for universal public health care since we were created in 1960. Tommy Douglas was named the greatest Canadian, I think in large part because he's credited as being the father of Medicare in this country. Quite honestly, I'm not interested in credit. I don't think credit is what's important here. You know, if we as politicians can come together and work across the aisle like the Liberals and the NDP have done, that brings primary necessary health care to 9 million Canadians, that's credit. That's I think that's reward enough. And we didn't do this for credit. We did this because we believe that every Canadian should have access to the primary health care that they need. You know, I want to end on the suffering. You know, if someone has a dental problem, and we all have had in our past, everybody's had a toothache, it's excruciating. It's on our face. It's part of our image. If you have you know, people are embarrassed about their mouths. This is something that no Canadian should have any objection to us investing some money in to make sure every Canadian can proudly hold their head up and have a healthy smile and a healthy mouth. That's the reward. And you know what? I have great faith in Canadians' common wisdom. You know, we didn't do it for credit, but I think at the end of the day, Canadians, when this plan is in place, Canadians are going to know that it was the NDP who demanded it, who fought for it, who got it done. And if people want to maintain this program and build on it to make it better in the future, there's only one way to do it, and that is to elect more NDP MPs. And I don't think anybody will have any illusions about that.
And I would add that the Canadian Health Coalition was right there alongside the NDP pushing for this, and for pharmacare, which is another topic that we've been working on in concert with Don and his colleagues and members of the Liberal caucus as well. I just wanted to say we're going to make a video available, I think, isn't that right, Tracy Glynn, of the webinar, so people can go and listen to it or pass it on to friends. For those people who don't feel that their question was adequately addressed, for example, somebody who's very keen to know what public health dental clinics will be able to will be required to do and how they address the whole question of the bureaucracy of enrolling, maybe they can address Brandon directly. Find Brandon online. He is the founder of the Coalition for Dentalcare. He's very active on Twitter and on other social media platforms. He's easy to get a hold of. And I would again encourage people to read his book and get a hold of the copy of the book. I also want to mention before closing, our next webinar, the Canadian Health Coalition is having a webinar on April 30th with Colleen Fuller of the Canadian Centre for Policy Alternatives on the concept of universality, because we have realized that a lot of people don't understand what universality is. They don't understand why we're opposed to means testing, what the concept of universality actually entails, because it's been so there's so much dust in the air around this, thrown up in the air partially by ideological opponents of universality. So we're going to have a webinar on that subject, as well as the other 4 premises of the Canada Health Act, in the next month and a half, leading up to a research symposium we're holding in Ottawa, organized by my colleague Tracy Glynn on June 20th at the Law Faculty of the University of Ottawa. So leading scholars on health issues will be there presenting their work. So we're going to elaborate on the Canadian Health Act, and then we're going to have this research symposium in June. So do stay in touch and check us out. Our webpage has lots of really good information, including the scheduling of these different events. And I just really need to thank, in the most fulsome fashion, Dr. Brandon Doucet in Nova Scotia for joining us and for all the good work he does. And Don Davies, who we have great admiration for his lucidity and clarity of concepts and dedication to the cause. And I want to also thank my colleague Tracy Glynn for handling she's like the wizard behind the curtain in the Wizard of Oz, making sure all the dots get connected. And my colleague Steve Staples, also with the Canadian Health Coalition. And a special warm thanks to all of you for joining us tonight and for the work that I'm sure many of you are doing in the defense of equitable access to healthcare, dental and otherwise. So until next time, merci à tous et à toutes. À la prochaine. Everybody take care of each other. Thank you very much.